Question. A 55-year-old female patient is admitted to the cardiac unit with a confirmed diagnosis of myocardial infarction. The nurse is providing education to the patient about lifestyle modifications following an MI. Which of the following recommendations should be included in the nurse's teaching plan? Select all that apply. A. Encourage the patient to resume smoking. B. Instruct the patient to limit physical activity. C. Promote a diet high in saturated fats. D. Encourage the patient to engage in regular exercise. E. Instruct the patient to avoid all vaccinations. F. Promote a sedentary lifestyle. The correct answer is D. Encourage the patient to engage in regular exercise. E. Instruct the patient to avoid all vaccinations. And B. Instruct the patient to limit physical activity. Question. A 60-year-old male patient is recovering in the cardiac unit following an acute myocardial infarction. The nurse is reviewing the patient's medication regimen. Which of the following medications are commonly prescribed for secondary prevention after an MI? Select all that apply. A. Anticoagulants. B. Antidepressants. C. Oral hypoglycemic agents. D. Statins. E. Bronchodilators. F. Nonsteroidal anti-inflammatory drugs. The correct answer is A. Anticoagulants, D. Statins, and B. Antidepressants. Question. A 65-year-old female patient is admitted to the cardiac unit with symptomatic PVCs. The nurse is providing education to the patient about managing PVCs and reducing their occurrence. Which of the following recommendations should be included in the nurse's teaching plan? Select all that apply. A. Avoid all physical activity and bed rest. B. Limit fluid intake to prevent dehydration. C. Eliminate caffeine and stimulant intake. D. Consume a diet high in sodium. E. Engage in intense aerobic exercises. F. Discontinue all cardiac medications. The correct answer is C. Eliminate caffeine and stimulant intake, and E. Engage in intense aerobic exercises. Question. A 68-year-old female patient presents to the emergency department with palpitations and lightheadedness. She has a history of hypertension and diabetes. The nurse suspects atrial fibrillation based on the patient's irregular heart rhythm and absence of discernible P waves on the ECG. The nurse understands that various conditions can predispose individuals to atrial fibrillation. Which of the following are associated with an increased risk of developing atrial fibrillation? Select all that apply. A. Hyperthyroidism. B. Chronic kidney disease. C. Chronic obstructive pulmonary disease. D. Valvular heart disease. E. Iron deficiency anemia. F. Type 2 diabetes mellitus. The correct answer is A. Hyperthyroidism, D. Valvular heart disease, F. Type 2 diabetes mellitus, B. Chronic kidney disease. Question. A 56-year-old male patient is admitted to the cardiac unit with newly diagnosed atrial fibrillation. The healthcare provider prescribes anticoagulant therapy to prevent stroke. The nurse understands the importance of assessing the patient's eligibility for anticoagulation. Which of the following factors should be considered in determining the patient's eligibility for anticoagulant therapy? Select all that apply. A. Age younger than 65 years. B. Absence of comorbidities. C. Normal renal function. D. Absence of bleeding disorders. E. History of prior stroke or transient ischemic attack. F. Recent onset of atrial fibrillation. Less than 48 hours. The correct answer is C. Normal renal function, D. Absence of bleeding disorders, E. History of prior stroke or transient ischemic attack, TIA, and F. Recent onset of atrial fibrillation, less than 48 hours. Question. A 72-year-old male patient with a history of atrial fibrillation is brought to the emergency department after experiencing chest pain. The patient is diagnosed with acute coronary syndrome and undergoes percutaneous coronary intervention, PCI. The nurse understands that certain medications are commonly prescribed post-PCI to manage atrial fibrillation. Which of the following medications are appropriate for rhythm control in this patient? Select all that apply. A. Beta blockers. B. Calcium channel blockers. C. Digoxin. D. Amiodarone. E. Warfarin. F. Angiotensin-converting enzyme inhibitors. The correct answer is A. Beta blockers, B. Calcium channel blockers, D. Amiodarone, and F. Angiotensin-converting enzyme inhibitors. Question. A 50-year-old male patient presents to the clinic with complaints of palpitations and occasional dizziness. He has a history of hypertension and is currently taking antihypertensive medications. On auscultation, the nurse notes irregular heartbeats with early, wide QRS complexes on the ECG. The nurse suspects premature ventricular contractions, PVCs, and understands that certain factors can contribute to their occurrence. Which of the following are common causes or triggers of PVCs? Select all that apply. A. Anxiety or stress. B. Dehydration. C. Hypothyroidism. D. Stimulant use. For example, caffeine and nicotine. E. Acid reflux. F. Iron deficiency anemia. The correct answer is A. Anxiety or stress, B. Dehydration, D. Stimulant use, example, caffeine, nicotine, F. Iron deficiency anemia. Question. A 30-year-old male patient is admitted to the hospital with a diagnosis of restrictive cardiomyopathy. He complains of fatigue, exercise intolerance, and abdominal swelling. The nurse reviews the patient's laboratory results and finds decreased serum albumin levels. Which of the following underlying conditions is commonly associated with restrictive cardiomyopathy? Select all that apply. A. Systemic lupus erythematosus. B. Hypothyroidism. C. Chronic kidney disease. D. Type 2 diabetes mellitus. E. Chronic obstructive pulmonary disease. F. Iron deficiency anemia. The correct answer is C. Chronic kidney disease. Question. A 45-year-old male patient collapses suddenly while playing basketball. Bystanders call for emergency medical services, and upon arrival, the healthcare team finds the patient unresponsive, pulseless, and not breathing. The team initiates cardiopulmonary resuscitation, CPR, and attaches a defibrillator. A rhythm strip reveals chaotic, irregular, and disorganized electrical activity. The healthcare provider diagnoses ventricular fibrillation. Understanding the management of ventricular fibrillation, which of the following interventions should be implemented immediately? Select all that apply. A. Administer intravenous fluids. B. Initiate synchronized electrical cardioversion. C. Perform endotracheal intubation. D. Administer intravenous antibiotics. E. Initiate chest compressions. F. Administer beta blockers. The correct answer is B. Initiate synchronized electrical cardioversion. E. Initiate chest compressions. Question. A 60-year-old female patient is admitted to the cardiac intensive care unit with a history of coronary artery disease. During her stay, she develops ventricular fibrillation and receives immediate defibrillation to restore a normal rhythm. The nurse recognizes the importance of ongoing management to prevent recurrent episodes of ventricular fibrillation. Which of the following interventions should be included in the patient's plan of care? Select all that apply. A. Administer prophylactic antibiotics. B. Initiate anticoagulation therapy. C. Monitor electrolyte levels regularly. D. Administer bronchodilators. E. Perform daily blood transfusions. F. Prescribe anti-anxiety medications. The correct answer is C. Monitor electrolyte levels regularly. B. Initiate anticoagulation therapy. A. Administer prophylactic antibiotics. And F. Prescribe anti-anxiety medications.